23rd, Joe Delro Nujats, and this is our, according to my calculations anyway, our 179th COVID-19 Task Force update. On the program today, we'll be speaking to Lloyd Phillips, and we'll start things off today with Lisa Westaway from the Cadbury Memorial Hospital Centre. She's the Executive Director, and she'll be talking to us today about isolation procedures, some stats, and a couple of other noteworthy items. Lisa?
Thank you. So, as of this afternoon, we have one active case in the community. This again is very good news. However, we are testing more and more people at the testing site, and this is for a very good reason. So the total amount of tests that we've done since the beginning of COVID, or since our testing site has opened, is 2,065. And we've had a total of 107 positive cases between the first and second wave. In the second wave, we're up to 85. However, as I mentioned, only one active case right now. But there have been some changes to this, to our staff symptom log. So what is it that we require in order to get a COVID-19 test, and what alerts us to the fact that we should be tested? So a few weeks ago, Dawn presented these changes. What these changes mean is that every employee from every organization must do their own self-evaluation before coming to work. And if they have any symptoms, either one symptom in part A or two symptoms in part B, then they stay home. But we also have this evaluation form, this symptom monitoring log on our KMHC website, because we urge all community members to do this personally every day so that they can decide whether they should come in for testing or not. And in the last week, there were some changes that have led to an increase in our testing at the testing site. So I'll just repeat what those changes are. They're in yellow, but you probably can't see them. Sore throat has been moved to the A symptoms. So A symptoms are new cough or worsening chronic cough, fever or chills, difficulty breathing, sudden lack of taste or smell without nasal congestion. Sore throat is added to the list, as well as runny nose or nasal congestion of unknown cause. So meaning you don't have allergies, or you have allergies and you're taking your allergy pill, but yet you have this new runny nose that's consistent. If you have any of those symptoms, you should be calling the testing site to be tested. That is really important. And we know a lot of people have runny nose. We know a lot of people have very similar symptoms to cold symptoms. However, the reason why this was moved up to the A symptoms is because we are seeing people who have very, very few mild symptoms who in the end become COVID positive. And if you're not being tested, then you have no way of knowing that you are actually COVID positive, and you could be transmitting the virus to others. So again, sore throat and runny nose has been moved up to the A category. This is important. B category has also changed somewhat. So again, in the B category, you would have either one of the top and one of the bottom, or you would have two of the bottom symptoms. So on the bottom, we have new onset headache. We also have new onset pain, which is not related to exercise, new intense fatigue, new severe loss of appetite, abdominal pain, which is new. That's added to the symptoms. You're making me think of Frosty the Snowman. Okay, and gastro symptoms, diarrhea, nausea, or vomiting. So that was already there. So the abdominal pain is new. If you have two of those symptoms, then you should be calling to get tested, or if you have one of the B symptoms and one of the A symptoms, then you should be calling to get tested. So we feel we've had an increase in testing at the testing site since these changes have come to light. And what that tells me is that you are all paying attention, you are self-evaluating, and you are calling when you need to call. There are some new changes as well with respect to these symptoms. The first thing is, if you have one of the top, one of the bottom, or two of the bottom, you should be isolating whether you call to get tested or not, because the new directive is that you are presumed to have COVID unless a COVID test tells you otherwise. That means that whether you get tested or not, if you have these symptoms, you should be staying home for 14 days, unless a COVID test and public health tells you that you can be released from isolation. The other change, and this is a change that we have put in place, that we had put in place several weeks ago in schools and daycares. The other change is that if anyone in your household has COVID symptoms, is awaiting a COVID test result, or is awaiting a COVID test, then in those instances, the whole household should be isolating until public health releases that person from isolation. Now, what does this mean concretely? What this means, and I'll take step by step as an example, and I know that this is very difficult for the community, it's very difficult for families and for people who work, it's going to be difficult for employers as well. What this means is that if your child, for example, develops a sore throat or a runny nose, then they need to stay home and they need to have a COVID test. And when they stay home, the whole family that lives in that household must also stay home until the COVID results come in. And then public health will decide, based on your analysis of your situation, whether you've been in contact with a positive case or whether you just simply develop these symptoms, based on your result, whether you can go back to daycare or whether you have to stay home for the remaining of the 14 days. This is something that's very different than the way that public health has been working in the past, and in fact it's different than the recommendations from INSPQ across the province. These changes are being put into effect. Although we don't have clear reasoning why, we do know that that we have many mild cases of COVID related to sore throat, runny nose, and we do also know that transmission predominantly happens within the family unit, so within the household, and as a result of gatherings. And we also are getting more and more information about variants that could potentially, and it's still not validated by the data, but could potentially be more transmissible and more deadly. And so these new rules are a way to avoid transmission outside of the family unit and keep the virus contained as much as possible. So I'm just going to repeat that again, and it is very difficult. And because we've implemented this change already in the daycare, in Step by Step, in the schools, we see how difficult it's been on families because we're not used to staying home as a whole family when our 2-year-old has a runny nose. We're used to waiting it out and then sending them back to daycare, or a runny nose, let's face it, before COVID we were sending our kids to daycare in those situations. So we have to be really kind and mindful to the employees that are refusing your children on their premises. I know, we all know how difficult this is, but the bigger picture is that we try to avoid transmitting the virus to others, and we try to contain the virus, especially in the face of some unknowns that we're now facing with respect to the variants. So again, I'm just going to repeat that specific directive. And for those who work in any of the EDC organizations or any of the businesses, for those people who complete this symptom log on a daily basis for your work, the changes will be made in the coming days and the implementation will happen within your organizations very shortly. But I felt it was important to explain this to the community as a whole because public health will be implementing these measures right away if we do have any of these particular cases. So if anyone in your household has COVID-related symptoms, whether you choose to get tested or not, and we urge you to be tested because that could release your isolation more quickly. But if you have COVID-related symptoms, anyone in the household, if you are waiting for a COVID test or you're waiting for a COVID test result, then your whole household must be isolated until you get the release of isolation from public health. If you choose to not cannot be tested, then you will be presumed as having COVID, and you will have to isolate you and your whole household for the full 14 days. So we will have this information up on our website as well, and if you have any questions regarding this, you can either see your employer or contact our public health. Thank you.
Thank you very much, Lisa. Coming up next is the Commissioner of Public Safety, Lloyd Phillips. Lloyd will just give us a little kind of recap of the last few days and give us some of his final thoughts. Lloyd?
Thank you, Joe. Thank you, Lisa. Yeah, I know there's a lot of information there regarding some of the new directives and the new way of evaluating your symptoms. So if you have to replay this and listen to it again, that's fine. Or like I said, there's information that's going to be posted on the websites, and there are people available to answer your questions. No, it is very important at this point in time, because there are those concerns out there. I'm sure we all been hearing about it, and Lisa talked about it a little bit about the new variants that are potentially more transmissible. So now we have to make sure that we really buckle down. We know that the vaccine is going to be coming relatively shortly in the next weeks. We have some in the community. And then obviously even after you get vaccinated, there is a period of time where your body builds up immunity. So again, we've been through this storm for just about a year now. And we hang in there a little bit longer, follow the latest measures, to minimize any possible spread in the community. Great news, only one active case as we speak in Kahnawà. And it's not that we're not expecting additional cases, but as we said several times, we want to ensure that we minimize that as much as possible, and keeping it manageable. And a lot of the information that Lisa just relayed to you is part of that. The numbers in Quebec have been doing well, which is good. Like we always said, we always watch what's happening in and around Kahnawà, Montérégie, and Greater Montreal area. Today they had like 739 cases, which has been around the same amount, between 600 and 800 for the past weeks, which is good. And these are some of the lowest, trends since early October. So if everybody's collectively sticking to the measures, again, let's keep those numbers at a manageable level. And I know you may have heard on the news as well, people talking about the possibility of a third wave. Well, no, that's totally within our control as Kahnawà and as people living in this country, on measures that we take could prevent a resurgence, and so let's hang in there just a little bit longer. And some of the concerns regarding the variants are obviously real concerns. We've getting several questions here at the task force, and we have as we know, we have Dr. Gauthier who looks at some of the information and relays her view and her opinion on what's behind the headlines. It's one thing to watch a 2-minute news story and get some information, but we have obviously professionals and people very knowledgeable in that field to actually do some research and give us some good advice. So and we'll relay that information to you as much as we can and as fast as we can as things develop. And just one example, I know if you may have heard, there have been several schools in the Montreal area that have closed down, as well as in Quebec City, because they had suspected the new variant. So they took large steps in closing the entire school until they get some results and testing almost all the students. Again, that's a level of concern that certain areas have. But fortunately, in Kahnawà, when it comes to the school systems, we did take some strong measures in conjunction with Robin Dallaron, the Director of Education, and the task force, and ensuring that we took steps going back to October to have the vast majority of our students doing remote learning to try to minimize the spread of the virus, obviously in the school system. We understand that caused some heartaches in the community and it caused some problems for families, but at the end of the day, we have not to date, knock on wood, had any outbreaks within our school system. So things are progressing, things are moving along, and again, there is that light at end of the tunnel. The target date we still have is around March 15th to have vaccines in the community. Again, that's a target. There's certain things that are certainly beyond our control, that when the vaccine comes from overseas into Canada, but we're trying to set a target date. And as we said, we're still trying to have the community vaccinated, over a period of about 3 weeks, starting shortly after that date. So we'll keep you up to date on that. I just want to again reassure the community that we're constantly watching these things, we're constantly evaluating where things are going and adjust ourselves accordingly. Better be careful, to be quite frank. So again, like I said, because certain things are beyond our control, but we also want to make sure that people are understanding that, and not to be discouraged, because there is positive developments happening in the community and all around us. On a last note, in the lines of the positive developments, and I spoke about this on K103 during the week. There is a package which was developed, which was going to be discussed with Council on the amendments to the emergency preparedness law. Because the emergency preparedness law is functioning. It's a Kahnawà law. It's given the authority to do what we have to do. But there is an area within emergency preparedness called the recovery phase. And in the law, it's in a way that it's either state of emergency or nothing, and we can't go from where we are now to like no authority whatsoever or no directives whatsoever for the task force. So we're creating a measure within the recovery phase of an emergency, whereby we could evolve out of a state of emergency into recovery phase, where certain mandates of the task force could remain intact, where certain directives could remain intact, but the goal is to continually decrease those measures and return back to a sense of normalcy, to eventually we at one point then we end the entire mandate of the task force and let life continue, so to speak. So that just let you know, those are some of the things that are in the works. Things are being developed. We're not at the point as we speak today to transition out of state of emergency, but we're putting the pieces in place that need to be put into place so that when we're ready, we're good to go. So with that, I'll turn it back over to Joe, and I'll talk to you soon. And Onigawahi, take care.
And thank you so much, Lloyd. And as we always say, we will keep you up to date on any information as it happens and as it relates to Kahnawà. Just a final note before we leave. Some good news today. Some good news that followed some rough news. As we know, in January, the Kahnawà Fire Brigade, one of the ambulances was in an accident. It has been written off. In the meantime, they've been using a rental, but they have placed the order today for a brand new 2022 Crestline Commander. And just of note, it's fully equipped. It costs over $231,000, but it just makes me feel a little old because it reminds me of a radiothon we did several years ago, back in the 80s, to get a brand new ambulance for the fire brigade. And the cost then, $35,000. Ouch. Things are a little different now. But congratulations to the fire brigade for getting a brand new machine. It should be here sometime in July or August. And that'll do it for us. So on behalf of everyone here at the Kahnawà COVID-19 Task Force, take care of yourselves, and we shall see you on Thursday. Niauko Adano Honigiwahi.